Hello everyone. In this video I'm going to talk a little bit about Project 2025. I have decided that I am going to break it down into smaller videos. But this video is pertaining to 10 reasons why a second Trump presidency will decimate sexual and reproductive rights. And as we focus more on LGBTQIA things on this channel, Project 2025 is something that will be affecting everybody. Even those that are literally saying, oh, it's not going to hurt me none. It's going to be a very rude awakening for many people. And the rest of us that know what's coming, it's already traumatizing a lot of people. And then later, the other people will be traumatized. So it's devastating. But when President-elect Donald Trump takes office again in January, sexual and reproductive health and rights, known as SRHR, will face unprecedented threats from the federal level. The second Trump administration will not only reenact many hostile policies from the first, but also almost certainly expand its assaults on SRHR. In the United States and abroad. Let me say that again. In the United States and abroad. It's not just an us thing. Guided by the detailed agenda for dismantling civil rights outlined by conservatives in Project 2025, the Trump-Vance administration will work quickly to implement new measures that erode bodily and reproductive autonomy. And the first part is going to be blocking abortion access nationwide. Now, before I get into this, let me give a little bit about my stance on abortion. Abortion is something that's very controversial to many. It's like even the people that agree with it can't agree on why they agree. And the people that disagree with it, 99% of the time use the Bible as the reason. But even those people can't agree on which verse to use to back their belief. And the other 1% that don't use the Bible has no reason other than they want the power over somebody else's body. I fall into the category that do whatever the fuck you want. I'm not saying that I agree with children being killed or taking the life of other people. But there is so much scientific and medical research that is done. And there is so many causes to need an abortion. If I come across an 11-year-old child that was raped and got pregnant, and their family doesn't want the child to go through the pregnancy, the trauma of the labor, and having to raise that child if the mother survives the pregnancy being so young, then I'm all for it. Go for it. Give the mother a chance to live life in a positive way. If a baby is going to be deathly sick its whole life, and the mother and the father want to abort because they don't want to see their child suffering, then I'm all for it. If a woman is assaulted and just doesn't want to raise the baby and she wants to end the pregnancy, I'm all for it. There are certain times that I believe that no matter what the parents choose is the right thing for their family, for their situation. Now, that I probably already offended many people, I do not believe that parents should just go out and have an abortion because they want to better their career before they start a family. I don't think a mother should go and have an abortion because her husband was arrested for murder and she doesn't want to carry his child anymore. No, I do not believe in abortion in situations such as those. Adoption is an alternative. Family, kinship. You know, there's many other avenues for families to go down when it comes to certain situations. So that's my stance on abortion. If one of my children come to me and said that they were going to have an abortion because they want to go to college and start a career before they start a family, I would ask them to have the baby and give me custody. Let me raise it. They can still see the child whenever they want to. They can be known as the mother or the father, or however it would work for them. I would ask that they not have an abortion for a situation like that. But if my daughter come to me and said that she was having an abortion because she was assaulted, then yes, I would fully support my child in her decisions. I would give them the same opportunity to give me custody of the baby or help them find an adoptive family. But at the end of it, I would still support their decision to do as they please. Because it is their body. It is their life. And I support my children no matter what. If I don't agree with something, I tell them. We work it out. We come to an agreement. And even though I have adult children that's married and have their families and everything, we all still have very open communication. And especially when it comes to my grandkids. But that's because they know that I'm not going to judge them, that I'm not going to prosecute them within the family setting. Like, you know, I'm going to be there to support them and to love them no matter what. And when I view the world and the people in it, I come to that with the same understanding that I would with my own children. So there, I probably offended quite a few people. Sorry, not really sorry, but that's just my view. The Trump-Vance administration could immediately signal through statements or official guidance from the U.S. DOJ that it will enforce a radical and legally unsound interpretation of the Comstock Act. This would likely target medication abortion, but could go as far as to effectively ban all abortions nationwide. Even the threat of enforcement would create a chilling effect for providers who might halt provision if faced with potential criminalization. President-elect Trump along with his Secretary of Health and Human Services and political appointees within the U.S. Food and Drug Administration, will likely direct that agency to severely restrict and potentially eliminate access to mifepristone. I'm really not sure how to say this medicine, but it is one of the drugs used in a common medication abortion regimen. Trump appointees will likely push to reinstate medically unnecessary requirements that would, among other things, eliminate access to that medicine via telehealth. The Trump administration could also attempt to a more extreme stratagem, rescinding the drug's approval altogether. For either tactic, these ideologically motivated appointees would be disregarding substantial scientific evidence of the medicine's safe and effective use in the United States for nearly 25 years. The federal government will likely stop enforcing the Emergency Medical Treatment and Labor Act's requirement that hospitals provide emergency abortion care to any patient who needs it. The administration could also direct the DOJ to withdraw from ongoing litigation defending access to emergency care for abortion in states that otherwise ban abortions. And the next one is reinstating and expanding the global gag rule. During his first administration, President-elect Trump reinstated the so-called global gag rule, a policy that prohibits U.S. global health assistance from going to any non-U.S. organization that provides abortion care or referrals using its own non-U.S. funds. He had expanded this policy to apply to all global health assistance, not just global family planning assistance, as was the case in prior Republican administrations. Research shows that this implementation of the global gag rule had detrimental impacts on reproductive health outcomes, caused programs to scale back or shut down entirely, decreased access to contraceptives, and had a chilling effect on global public health partners. Expect the incoming administration to immediately reinstate the policy in its expanded form and potentially broaden it to cover all U.S. foreign assistance, including humanitarian assistance. Next up will be reinstating the domestic gag rule. President-elect Trump will almost certainly initiate rulemaking to reinstate the so-called domestic gag rule, implemented during his first term in office. The rule prohibited providers who are part of the federally funded Title X family planning program from referring patients for abortion care, among other intentionally onerous requirements. The original rule in 2019 decimated the program's network of family planning clinics and constrained its ability to serve patients with low incomes. Even though through the Biden-Harris administration rescinded the rule in 2021, the program is still recovering. With it still recovering, it won't take much to completely get rid of it. The next one, undoing President Biden's protective administration actions. President Biden issued several executive orders and memorandums and took other actions to protect and expand access to reproductive health services. Expect the Trump-Vance administration to quickly nullify these efforts. It will likely dissolve the Interagency Task Force on Reproductive Health Access, as well as the White House Gender Policy Council, take down www.reproductiverights.gov, the government website dedicated to providing accurate information on reproductive health care access, and eliminate the Section 1115 Medicaid waiver option for states to support patients' travel out of state abortion care. Next up is amplifying misinformation and stigma. Rather than using the tools of government to promote evidence-based information about how to access care, President-elect Trump will undermine programs and policies while promoting falsehoods about the safety and legality of abortion and contraception. This includes appointing anti-abortion leaders and advocates to influential government positions, particularly in the U.S. Department of Health and Human Services, where they will be able to heighten dangerous rhetoric and increase stigma around reproductive health care. Expect Trump himself and his appointed ideologues to spread mis- and disinformation about sexual and reproductive health. Next up is reversing protections against discrimination. The Trump-Vance administration will likely mimic the first Trump presidency by countering measures that protect individuals seeking health care from discrimination, including those who have previously received abortion care and LGBTQ+ individuals. Expect him to rescind recently strengthened regulations regarding Section 1557 of the Affordable Care Act, the ACA, HIPAA protections for reproductive health data, and enhanced Title IX protections for students. Next, we'll be dealing with the attacking of the Affordable Care Act's birth control benefit. Expect the incoming administration to reprise efforts to undermine the ACA's contraceptive coverage guarantee. The administration will likely again allow employers and educational institutions to avoid offering coverage in their employees' or students' health plans by claiming moral and religious exemptions. This would prevent their employees and students and their dependents from being able to obtain the contraceptive methods of their choice without additional out-of-pocket costs. Next is threatening sexual and reproductive health and rights globally. The Trump-Vance administration will likely nominate anti-SRHR advocates as special representatives, envoys, and ambassadors to conduct U.S. foreign policy. Expect them to influence the drafting of UN resolutions and reports, policy statements, and technical literature with language that assails gender equality, curtails human rights, and degrades SRHR globally. These diplomats may also try to reinvigorate a coalition of signatories to the Geneva Consensus Declaration, a document that undermines human rights and was rightfully never adopted by the UN. Also anticipate the administration to block funding for the United Nations Population Fund, as it did during President-elect Trump's first term, and jeopardize funding for international family planning and reproductive health through U.S. global health programs and the Economic Support Fund. And up next is eliminating access to gender-affirming care for minors. President-elect Trump has explicitly laid out some of his plans to eliminate access to gender-affirming care for minors. He has threatened to block physicians who provide this care to minors from receiving federal funding from Medicare and Medicaid, and to have the DOJ investigate the provision of gender-affirming care. Now, I'm going to take a little bit of a break there and discuss that part, because everybody always jumps to don't let minors have surgeries, don't cut off this and don't cut off that because they may change their mind. Okay, that's complete bullshit, straight up. If you're not part of the community and you're on the outside looking in, you have a lot of misinformation, basically by the Trump administration, on what gender affirming care is for minors. And then I'm going to break it down a little bit farther for the cis people. Gender affirming care for minors is basically hormone blockers. That's it. Trans boys can wear a binder. Trans girls can wear a gaff. That's literally nothing more than just a garment that they wear underneath their clothes. It doesn't do anything to change them medically or surgically. Letting them cut their hair, letting them grow their hair out, letting them wear their makeup, whatever. That's all gender affirming care. That's it. That's gender affirming care. The only medical thing that is done for trans and non-binary children is hormone blockers. And that is literally something that just prevents puberty from happening so that the child can learn to accept their body as it is, so that the child can mentally prepare for puberty at a later date, so a child doesn't have to be traumatized by their voice lowering, or doesn't have to be traumatized by growing breasts. There are many things that fall under gender affirming care for minors that has nothing to do with medically transitioning. Because if you take a hormone blocker so that your testosterone level doesn't make your voice drop, or it doesn't let your estrogen level make your breasts grow, but once you stop it, whatever happens, happens. It just pauses it. That's it. It pauses it. After the child turns 18, they can use a different hormone. They can go on testosterone if they're trans boys, or they can go on estrogen if they are trans girls. But this is done after they are 18. But the blockers prevent their bodies from changing beforehand. You see what I'm saying? It's not cutting off this, and it's not cutting off that, or it's not attaching this or attaching that. That all comes later in adulthood. And after many, many gatekeepers. It's not like you can just turn 18 and be like, oh, I'm going to go, do that. No. It's years of being able to get to where the person wants to be. So why would we want to make their life even harder by not allowing them to have the hormone blockers? Okay, and for the people that I just offended with that, hormone blockers are also used in adults that have certain types of cancer. I may actually do a video about this later. It's also used for many reasons to save a life that is not trans related. Let that sink in. Because this is one of those things that if the gender affirming care is stopped, then your mother, your grandfather, your uncle, your whatever that has those certain kinds of cancers that's out there, or illnesses related to hormones, then they're not getting that treatment either. Let that sink in. Your straight, white grandfather may need a hormone blocker at some time in his life to save his life, and he will be refused treatment because it is now a transgender medicine only. So let that sink in. And then the last thing on this list is defunding Planned Parenthood. Planned Parenthood clinics receive reimbursement from Medicaid, Title IX, and other publicly funded programs for providing such care as contraception, STI screening, STI treatments, and cancer screening. The Trump-Vance administration would likely encourage states to defund Planned Parenthood by making Planned Parenthood affiliates ineligible to receive reimbursement from Medicaid and other publicly funded family planning programs. The administration could also attempt to issue a federal regulation making providers that offer abortion care, such as Planned Parenthood, ineligible for federal Medicaid funds, which would impact family planning services and other care availability nationwide. So for everybody that's out there saying, defund Planned Parenthood because it's a LGBTQIA plus organization and that's what they do, they're corrupting our minors, and we gotta erase the trans people, so let's take away all their medical choices, and you're also taking away your own sexually transmitted disease counseling, testing, treatment. You're taking away your mother or your grandmother's breast exams for breast cancer screening. You're taking away your own or your father's or your grandfather's prostate screenings to make sure that they remain healthy and that they don't have cancer. Planned Parenthood is more than just a gay resource or a trans person's way of accessing hormones. Planned Parenthood is simply like a health department that helps people stay healthy. So this is just a little bit of what we are facing with Project 2025. And this is pre-Project 2025. Like, this is what they're going to be doing as soon as they come into office. And everybody wonders why people are in an uproar and scared for their safety, scared for their health, scared about going to jail just because they have a trans child. Doctors are scared of medically helping people, no matter what it's for. And this is okay with so many people? Like, it's not okay with me. Yeah, I'm part of the community. But I also know a lot of people that's not part of the community I know some people that's not even an ally to the community and they have issues with this stuff. I also know a couple of people that I don't, well, I know them, I've met them, I've talked to them a few times, that's currently here in my town. Well, two people here in my town and one person in the next town over. They were all together when I met them. And they told me they seen my pride hat. And they said, so, are you gay or trans or what are you? That was their opening sentence to me. And I said, I am what I am. Why? And they started talking mostly to each other about what they thought I was. But they started somewhat including me in the conversation as we stood there in line and stuff. And it was like, they said that they've never been for the gay community. They kept just calling it the gay community. And at first I was like, no, it's LGBTQIA, there's more than just gay. And finally I just let it go, and I'm like, okay, like, I know what you mean, and I'm not going to waste my time trying to change your mind. But anyway, they kept saying the gay community. They've never stood for the gay community. They never understood the gay community. They weren't raised to accept the gay community. And then one of them said, I've never had an issue with the community, but I've never supported them either. And I asked him, I'm like, why not? Like, is it religion? Are you brainwashed? Like, you know, at this point I was kind of intrigued at, you know, at the stupidity of some parts of the conversation that they were having amongst themselves. But I was also aware that they were wanting information apart from what they already thought they knew, because they were including me in some parts that they were like unsure of. Like, they had their mind made up, but there were still little bits and pieces that they weren't sure of. So we continued this conversation for a little bit of time, and at the end of it, the older gentleman, he's like, I don't know if I can ever go to rallies, and I don't know if I can ever hold up signs and support the rights for gay marriage and stuff. And he looked me dead in the eye and he said, but Trump is fucking up everything for y'all. And he's like, I don't like that one bit. And he had a freaking MAGA hat on. Okay? So he's full on, like, Trump supporter. And he literally looked me dead in the eye and told me that he can't get on board with Trump's decision about all this shit, while wearing a MAGA hat and just referring to us as the gay community. So needless to say, I kind of left that conversation, and, you know, I started doing a lot of thinking about it. And I think a lot of the supporters are just supporting because they think they're supposed to, or some shit. Or maybe they're scared of being on the other side of all of his lies and shit. I don't know. I mean, I would much rather be on the other side of his lies and stuff. I'd rather be the ones that he's lying about or trying to erase than to be known as somebody that is on board with the way he is a racist, the way he talks to and about women, you know, all this stuff that he stands for. I am so glad that I'm totally against. It makes me a better person. But I do know a lot of people, don't start, you know, getting in a hissy now. I do know a lot of people that are Trump supporters that are really nice, decent people. And I know a lot of the Trump supporters, just like that one guy with the MAGA hat on, that don't agree with everything. Agree with a lot of it, and mostly the right for guns and economic growth. Even though they don't realize that the economic growth that he's always talking about is for the 1%. But that's still beside the point. Point of this video is to point out how the pre-Project 2025 stuff is going to open the door for so many horrific things to come into play with Project 2025. And as you can see just in this video alone, the stuff that they're trying to take away from the LGBTQIA plus community will impact those who are not LGBTQIA. It's a sad situation, a horrific situation, to where our United States of America is heading. And I'm not talking just LGBTQIA issues. I'm talking like, for example, the Delphi case, the law enforcement, the prosecution. I mean, that's some horrific shit going on. And this isn't a true crime channel or anything, but some of these cases and stuff that I've been watching, like, after Project 2025, even that's going to get a lot worse. Innocent people are going to be going to prison all the time. I mean, not that we don't already have innocent people in prison, because we do. We have a shit ton of people in prison that shouldn't be there. The whole prison reform system is fucked up. The way inmates are treated, even if they did commit their crimes, it's horrible. The conditions of the prisons, like the heating and the cooling and, passing out ice buckets. And, I've done a lot of work behind the scenes with, like, Lorenzo Gilliard and trying to get him his rights in prison. 100 and something degree weather and no air conditioning, no nothing, in a tiny ass cell with no fucking window, and refusing to even give inmates an ice bucket. I mean, there's been a lot going on in the Missouri prisons for the past 2, 3, 4 years. I finally got all that situated with him, and he got moved and to a better prison and a newer facility. And there's so much that I actually do behind the scenes, like, that I don't even bring to YouTube. But all this pre-Project 2025 shit that's going into place to open up the doors for Project 2025, I can literally tell you it's time to be scared about it. Whether you support the community or you don't, it's going to affect everybody. Like, they are even taking it globally. It's not just America that they are doing their shit to. So I'm going to leave this video at this. I mean, most of my average view time is like 1 minute and 50 seconds anyway, so I don't know. People just don't want to hear this shit, but I'm going to keep talking about it because somebody has to. Might as well be me. Much love, everybody. Stay safe, stay healthy, and hug your loved ones, because this world is turning into something else.